Hello and welcome to my channel. My name is Dr. Aisha Munk and I'm a psychologist and neuroscientist and medical doctor. Today we'll explore a topic that is often misunderstood and misrepresented in our society: narcissism. What exactly is narcissism? How is it different from narcissistic personality disorder? And what impact does narcissism have on relationships? In this video, we'll address these questions and delve deeper into understanding narcissistic behavior. By the end, you'll also have practical tools to navigate and manage narcissistic tendencies in your environment. Let's start by clarifying the term narcissism, which is often thrown around casually. People label others as narcissistic when they perceive them as self-centered or arrogant, but narcissism is much more nuanced. From a psychological perspective, narcissism exists on a spectrum. Healthy narcissism, for example, we all need a certain degree of self-esteem and self-confidence to function well in life. Healthy narcissism enables us to pursue our goals, assert our needs, and maintain resilience in the face of challenges. Unhealthy narcissism, however, occurs when self-esteem becomes overly reliant on external validation. People with unhealthy narcissism may display an exaggerated sense of superiority, have difficulty handling criticism, and prioritize their needs above all else. For example, imagine someone who always needs to be the center of attention at social gatherings, and if they're not, they become irritable or dismissive. That's a sign of unhealthy narcissistic traits. Narcissistic Personality Disorder, on the other hand, or NPD, is a clinical diagnosis that goes beyond traits and behaviors. It's a deeply ingrained pattern that affects a person's entire life. According to diagnostic criteria, someone with NPD exhibits traits such as an inflated sense of self-importance or grandiosity, a constant need for admiration and validation, a lack of empathy, making it hard for them to understand or care about others' feelings, difficulty maintaining healthy relationships due to exploitative or manipulative tendencies. It's important to distinguish between having narcissistic traits and meeting the criteria for a personality disorder. For instance, someone might struggle with occasional self-centeredness, but still maintain empathy and genuine connections with others. With NPD, these traits are pervasive and significantly impair their life and relationships. NPD affects roughly 1 or 2% of the population, while the stereotype often portrays these individuals as entirely toxic. It's essential to recognize that people with NPD often suffer as well, feeling isolated or struggling with underlying insecurities. Relationships with narcissistic individuals can be both captivating and challenging. At first, they may seem charming, confident, and charismatic. You might feel swept off your feet by their apparent self-assurance, but over time, certain patterns can emerge. For example, high expectations. Narcissistic partners often expect unwavering admiration and attention, placing their needs at the forefront. Manipulation tactics. Gaslighting is a common strategy, where the narcissistic partner distorts reality to make you doubt your own perceptions. Lack of empathy. During conflicts, they may struggle to see things from your perspective, often minimizing your feelings. And devaluation. If they feel criticized or neglected, they might respond with harsh comments, passive-aggressive behavior, or outright dismissal. For example, a narcissistic partner might shower with praise one moment, but could criticize you harshly the next if you fail to meet their expectations. Over time, this can create a dynamic where you feel emotionally drained and unsure of your self-worth. It's easy to wonder, why wouldn't someone just leave? But the answer isn't straightforward. Many stay in the relationships due to, for example, emotional dependence. Narcissistic partners can be incredibly persuasive, creating a push-pull dynamic that makes their partners feel both needed and trapped. A hope for change. They might cling to the initial honeymoon phase, hoping the relationship will return to how it once was. Or the fear of loneliness. Leaving can feel daunting, especially if the narcissistic partner has fostered a sense of dependency or isolation. For instance, a partner might rationalize staying because they're not always like this, ignoring the toll the relationship takes on their emotional health. If you find yourself in a relationship with a narcissistic individual, here are some steps to protect your well-being. First, recognize the dynamic. Understand that their behavior is not your fault. Set boundaries. Clearly define what you will and won't tolerate. Consistent boundaries are essential. Seek support. Talk to trusted friends, family, or a mental health professional to gain perspective and strength. Consider your options. Reflect on whether the relationship aligns with your long-term emotional health. In some cases, leaving might be the best choice. Remember, while it's important to have compassion, narcissism doesn't excuse emotional manipulation or abuse. To close, I want to emphasize that navigating a relationship with a narcissistic person can be incredibly challenging, but you don't have to face it alone. Understanding the dynamics is the first step towards reclaiming your emotional health and self-worth. Thank you for watching this video. If you found it helpful, please share it with someone who might benefit from it. And don't forget to subscribe to my channel for more insights on psychology and relationships. Take care and see you next time.